The subcommittee will come to order. The chair recognizes himself for an opening statement. Today, we will mark up the latest FDA user fee package discussion draft. This draft is the product of over a year of hard work by various parties. While the individual industries, prescription drugs, medical devices, generic drugs, and biosimilar drugs represented in this draft were negotiating with FDA on their user fee agreements, this subcommittee was holding at least 10 hearings on subjects related to the draft. After intense negotiation between both sides of the aisle, as late as this past weekend, we have arrived at a discussion draft that I hope all members of the subcommittee will be able to support. There are still some outstanding issues that staff continues to work on, and I hope that they can be resolved before Thursday's full committee markup. This package is critical to patients. It will ensure that FDA has the resources and reforms needed to speed new drugs, devices, and treatments to those who are ill. Good-paying jobs in the drug and device industries, like those in my home state of Pennsylvania, will be critical to our economic recovery, and we can't afford to outsource them. These user fee agreements will make the approval process more transparent, more consistent, and more predictable, benefiting patients, but also keeping the United States the preeminent leader in drug and device development and manufacturing. I now recognize my friend from New Jersey, Ranking Member Mr. Pallone, for 3 minutes for his opening statement.
Thank you, Chairman Pitts, for holding today's markup. The bill before us reflects weeks of negotiations between the staffs on both sides and represents strong bipartisan collaboration and compromise. While it's not entirely perfect, it's a consensus product that we should all be proud of. We set out in this process with the intention to work together, and we've done that exceptionally well. The user fees are an essential component of FDA's funding, and it's important to ensure that the American people have access to safe and effective health care products. This bill sets out to renew existing FDA programs that charge user fees to review product approval applications for pharmaceutical and medical device manufacturers. It also establishes new user fee programs for generic drugs and for lower-cost versions of biotech drugs. In addition, the bill also reauthorizes the Best Pharmaceuticals for Children Act and the Pediatric Research Equity Act, which both help to foster the development and safe use of prescription drugs for children. A significant improvement was also made to FDA's ability to police an ever-growing global drug supply chain. These provisions are based on the ideas and proposals contained in the Drug Safety Enforcement Act, which I introduced with Mr. Dingell, Mr. Waxman, and Ms. DeGette. And I want to thank Mr. Dingell for his leadership and hard work in this area, as well as Chairman Upton and Pitts for your willingness and sincerity. Together, we've given the FDA critical tools to keep our medicine safer. I'd also like to thank Dr. Burgess, who worked with me personally to address current conflict of interest statutes that apply to the FDA. These have unfortunately resulted in a system that was out of balance. Together, we've maintained critical public disclosure of potential conflicts and strengthened current recruitment activities at the FDA while avoiding unnecessary duplication of other existing conflict of interest protections. Our comprehensive agreement also includes provisions to address the recent increase in drug shortages and other FDA policy reforms. In addition, it includes a part of my bill, the Generic Drug Application Fairness Act, which aims to provide temporary relief from an unintended consequence of current law. Reauthorizing and revitalizing the FDA drug and device user fee system is a top priority for members on both sides of the aisle. So I want to thank you again, Chairman Pitts and Chairman Upton, and the staffs of both sides for the hard work they put in today's bill. They've been working so hard over the last, I don't know how many months, 4 or 6 months, I've lost track. And I want to particularly mention Tiffany Caraccio to my left, who's my staff person who's been working long hours, but all of the staff have been. And we're going to have to continue to do more work as we move on to committee, to full committee, and then move this bill to the floor and have it eventually signed into law. But this is all pretty much on course in terms of the timetable we set up, Mr. Chairman, and I think that's particularly amazing in this climate that we're able to keep to our timetable. Thank you.
Chair thanks the gentleman and agrees with your comment on the staff. On my side, particularly Ryan and Clay, thank you for to all the staff for all your good work. And I now recognize the Chairman of the full committee, Mr. Upton, for 3 minutes for his opening statement.
Well, thank you, Chairman Pitts, and I certainly want to start off by commending you for your tremendous leadership on this issue. At the beginning of the user fee process, I set 3 basic goals. First, I expected the process to be bipartisan. Second, I wanted the user fee bill enacted by the end of June next month. And third, I believed the user fee bill needed to foster American innovation so that we could get new treatments to American patients and create jobs here at home. And I'm proud to report that we are on track to accomplish all 3 goals, 3 for 3. I want to thank particularly Mr. Waxman, Mr. Pallone, Mr. Dingell, and members on both sides of the committee for their bipartisanship throughout the entire process. The bill before us today is a reflection of their hard work and their willingness to put partisanship aside to look at issues together. And because of that hard work and dedication, the bill is much improved, which will help American patients and American innovators. My second goal was to get the user fee bill enacted into law by the end of June, and we are, in fact, on track to accomplish that goal as well. Full committee will mark up this bill later this week, and I expect the bill to be on the floor yet this month. That will give us time to work with our good friends in the Senate to have the bill to the President before the 4th of July. Finally, I want the bill to foster American innovation, which is essential in getting new treatment to patients and creating American jobs. Because of the hard work of the committee members, I think we have done that. Let me highlight some of these provisions. User fee titles of the bill contain important metrics that will hold the FDA accountable for its performance. And because of the efforts of Mr. Barton, we'll get the FDA data down to the review division level and have the independent third-party assessments of FDA's performance for drug and devices written into the statute. Due to the leadership of the good Mike Rogers, Ms. Eshu, and Mr. Markey, Title V of the bill makes the Best Pharmaceuticals for Children Act and Pediatric Research Equity Act permanent. This will help in getting new therapies to our nation's children. Through the efforts of Dr. Burgess and Mr. Guthrie, Title VI provisions that will significantly improve scientific exchange at FDA's advisory committee and ensure transparency and public input in the development of FDA's guidance documents. Title VII will significantly improve FDA's regulation of medical devices, and because of the hard work of Mr. Shimkus, will fix the current problems with the investigational device exemption and the device modification guidance. Fixing these problems will bring clinical trials back to the U.S. and reduce regulatory uncertainty and delay that is hurting American medical device innovators. Title VIII will foster American innovation because of Dr. Gingrich's GAIN Act, Mr. Stearns and Mr. Towns' FIRST Act, and Mr. Lance's medical gas bill. And finally, Title IX will help our nation's patients, doctors, hospitals, and nurses as they deal with drug shortages so critical to deal with. Again, I want to thank Ms. DeGette, Mr. Walden, Dr. Gingrich, Mr. Bass, and Mr. Latta for their leadership on the issue. I don't know that I've missed anyone, but certainly have listed a good number of Republicans and Democrats that worked together. I want to particularly thank Ryan and Clay. Clearly, they were the glue on our side that indeed kept everything from falling apart, and I yield back the balance of my time.
Chair thanks the gentleman, and now recognize the gentleman from California, the ranking member of the full committee, Mr. Waxman, for 3 minutes for his opening statement.
Thank you very much, Mr. Chairman. I want to start off by commending you for holding this markup and to leading our subcommittee for a bipartisan achievement. The consideration of this bill should be a model for legislative action. This landmark legislation touches on some of the most essential areas at the FDA. With this bill, we will reauthorize the drug and medical device user fee programs, which will ensure that FDA has the resources necessary to review applications, give patients access to therapies at the earliest possible time. We'll also reauthorize the Best Pharmaceuticals for Children Act, the BPCA, and the Pediatric Research Equity Act, the PREA, which give FDA the authority to obtain information about the use of drugs in children. And this year, for the first time, we will be establishing 2 new programs to help speed FDA's review of low-cost generics and biosimilars. We will give FDA new tools to address the challenges posed by our increasingly globalized drug supply. Based on these provisions on the Drug Safety Enhancement Act introduced by Mr. Dingell, Mr. Pallone, Mr. Gett, and myself, we've worked hard to come to bipartisan agreement in this area, and when these provisions are enacted, Americans can take comfort in knowing that the drug supply will be safe as a result. When we started this process, we had disagreements, but we've resolved those disagreements. We've included some important provisions that will go a long way toward addressing at achieving this goal. However, I regret that we failed to narrowly tailor the bill to target only drugs that treat dangerous infections for which we don't have adequate treatments. As the bill reads now, essentially any antibiotic can qualify for the incentives included in the bill. I hope we can continue to work on this issue. I want to thank our colleagues on both sides of the aisle, and I particularly want us to pay a recognition to the hard work that our staffs have done. On the Democratic side, we have Rachel Scher, Eric Flam, Arun Patel, and of course Karen Nelson, Tiffany Garasio, Mr. Dingell's staff, Kim Trees. On the Republican side, Ryan Long and Clay Alsbach. Congratulations to all the staffs. They worked very, very hard. They had to deal with a lot of complicated, difficult issues, but they accomplished what all of us wanted, which is a strong bipartisan bill that we can move forward. Thank you, Mr. Chairman. Yield back the balance of my time.
Chair thanks the gentleman. And now recognizes the Vice Chairman of the Committee, Dr. Burgess, for 1 minute for opening statement.
I thank the Chairman for the recognition. I also want to thank the Chairman and Ranking Members of the Subcommittee and Full Committee for moving this reauthorization expeditiously and in a bipartisan fashion. The true impact of the medical device, pharmaceutical, biologic, and generic industries in the United States is that they are partners in providing our physicians and other providers with the tools they need to prevent and, most importantly, to alleviate human suffering. I also need to thank my staff, Mr. Poliskevitz, who really went above and beyond in working several sections of this bill. I appreciate the committee allowing me to be involved in the crafting and the drafting of this bill. I also want to thank Mr. Pallone for the new guidelines of how the FDA approaches, thinks about, and is allowed to ensure that they have the most up-to-date and scientific medical expertise needed to accomplish their critical mission to ensure medical products are safe and effective and to be the gateway to providing patients with better products in their lives. This markup has been transparent and respectful, and again, I thank the chairman of both and ranking members of both the full committee and the subcommittee. The hearings that we've had have been insightful, and look forward to an expeditious passage of this bill. I yield back.
Chair thanks, gentlemen. Now recognize the gentleman from Michigan, the ranking member emeritus, Mr. Dingell, for 3 minutes for his opening statement.
Mr. Chairman, I thank you for your courtesy. I commend you for your leadership, and I also commend my dear friend Chairman Upton and ranking members Pallone and Waxman and their staffs, in fact, the staffs of all who were involved, including my own, for the superb work done in presenting this proposal to the committee today. It has the support of Food and Drug, it has the support of the government, it has the support of the industry, and it has the bipartisan support of the members who have worked together on this in a long and difficult way. And if you look around the room, you will see that the lack of controversy here reflects the extraordinary work of the committee, of the members, and of the staff in achieving the success that we are about to enjoy in moving forward a superb piece of legislation. Is it everything that we want? Not exactly. I don't think anybody can ever agree on all of the things in the bill. But it is, however, a significant and meaningful advance in the law. In fact, it's probably the first real change that we've seen since the early 60s. And so we can feel very good. I want to commend you for your leadership and also our chairman, and specifically on the work that you and Mr. Waxman and Pallone have done working with me on the drug supply chain provisions included in the proposal before us. The provisions will provide FDA with an up-to-date information on domestic and foreign drug manufacturers, allow FDA to detain or destruct drugs that are found to be counterfeit or adulterated, require importers to register with the FDA and to comply with good importer practices. It will also encourage the prohibition of entry of imported drugs that have delayed or denied inspection by FDA, and encourage parity in the inspections of domestic and foreign drug manufacturing establishments. This has been a top priority of mine for a long time, and I believe that we can be proud of all the things in this bill, including providing FDA with the desperately needed tools and information to secure our supply chain at a time when we import massive amounts of pharmaceuticals from abroad and the building blocks that are used in manufacturing pharmaceuticals here in this country. Today's markup will advance user fee agreements negotiated by the industry and FDA and build upon the work already being done by FDA. Again, I commend you and Chairman Upton, and I am particularly pleased that we're moving forward with bipartisanship, cooperation, and compromise as we work towards final fashion, and we're showing that this committee can work as it has in the past by pulling together and by following the regular order. I commend you, Mr. Chairman, and my colleagues who have worked on this. Thank you.
Chair thanks the gentleman. Now recognize the Vice Chairman of the full committee, gentlelady from North Carolina, Ms. Merrick, for 1 minute for opening statement.
No, I will yield my time, Mr. Chairman.
The gentlelady yields to Ms. Blackburn of Tennessee for 1 minute.
Thank you, Mr. Chairman. I appreciate this. And the work on the legislation that we have before us, for us in Tennessee, this is a jobs issue, plain and simple. The life sciences industry employs more than 25,000 people in our state. Their average wage is $69,000 per year. The medical device industry in Tennessee ranks 7th in the country. Memphis is the 2nd largest center for orthopedic devices in the U.S., and these companies paid a total of $275 million in wages to Tennessee. So we look forward to having some certainty out of the FDA with this bill. Clinical trials are also important to our state. Many are conducted through St. Jude's and Vanderbilt and other institutions. I also want to mention CPATH and the Critical Path Initiative. And Mr. Engel and Congresswoman Giffords and I worked on this 5 years ago, putting it in place. It's an important role in bridging the gap between scientific research and product development, and I'm looking forward to having that continue. This bill will get us on the right track. Look forward to the discussion that ensues in passage, and yield back.
Chair thanks gentlelady. Now recognize the gentlelady from California, Ms. Capps, for 1 minute for opening statement.
Thank you, Mr. Chairman, and I thank you and Ranking Member Pallone, Chairman Upton, Ranking Member Waxman, Mr. Dingell particularly, for your leadership on this bill. The bill before us certainly represents the spirit of compromise across the aisle and between the many stakeholders that work toward innovations to improve our health. I'm especially pleased my bill to address post-market surveillance of medical devices and implementation of the Unique Device Identifier Program, the Safe Devices Act, has been incorporated into the base text. This is an important provision to know our devices work and identify potential problems early when they are easier and less costly to address. And while I think there is more we could do to address the root causes of advisory panel vacancies, ensure devices work in diverse populations, and also support pediatric clinical trial networks for rare diseases like SMA, spinal muscular atrophy, the bill before us is an important step to ensure that our drug and device pipelines continue to produce needed cures and treatments to keep us healthy. So I look forward to supporting this bill, and I yield back.
Chair thanks gentlelady. Now recognize the gentleman from Georgia, Dr. Gingrey, for 1 minute for an opening statement.
I yield, Mr. Chairman. I have no opening statement. Thank you.
Mr. Latta for 1 minute.
Thank you, Mr. Chairman, and thank you for holding today's markup on this very important issue regarding the legislation to reauthorize user fee programs for prescription drugs and medical devices, establish user fee programs for generic drugs, and reforming FDA programs. I want to thank you and committee staff for working with me on an important issue to hospital systems in Ohio and across the country regarding repackaging of drugs and a drug shortage. Specifically, I worked on language in the bill draft that assists hospital systems in coping with drug shortages by allowing them to repackage those drugs into smaller doses. Current law does not allow for a hospital to repackage a drug for use in another hospital within their own system. I'm very pleased that all parties work together in agreeing to the language that is included in the bill draft that allows hospital systems to repackage and transport the drug in a shortage to another hospital within the same health system. There are many important reforms contained in this legislation, and I look forward to supporting the bill today. Thank you, Mr. Chairman, and I yield back.
Chair thanks the gentleman. Now recognize the gentleman from New Jersey, Mr. Lance, for 1 minute for an opening statement.
Thank you, Mr. Chairman. This is my first term on this committee and subcommittee, and from my observation, this is precisely the way the Congress of the United States should work. I am pleased to see that the committee has included the Medical Gas Safety Act, a bill that I introduced to ensure access to medical gases by addressing regulatory uncertainty. The Medical Gas Safety Act is the product of compromise between the FDA and the industry to provide regulatory clarity that will ensure access to these life-saving products for patients while protecting jobs. I thank you, Mr. Chairman. I thank the ranking member. I thank your staffs for your support throughout the process. I also thank Jeff Last of my staff on working on this important issue. Thank you, and I yield back the balance of my time.
Chair thanks, gentlemen. Now recognize the gentleman from Louisiana, Dr. Cassidy, for 1 minute.
I yield back.
Gentleman yields back. Chair reminds members that pursuant to the committee rules, all members' opening statements will be made part of the record. Are there any further opening statements?
Mr. Chairman?
Yes.
I just wanted to ask for unanimous consent to enter a support letter from the Pew Foundation into the record, and I believe you have it.
We have it without objection, so ordered. All right. This time the chair calls up the discussion draft and asks the clerk to report.
Committee print to amend the Federal Food, Drug, and Cosmetic Act to revise and extend the user fee programs for prescription drugs.
Without objection, the first reading of the discussion draft is dispensed with, and the discussion draft will be open for amendment at any point. So ordered. The chair recognizes himself to offer an amendment, and the clerk will report the amendment.
Amendment to committee print offered by Mr. Pitts of Pennsylvania.
Without objection, the reading of the amendment is dispensed with, and I would like to recognize myself to speak on the amendment. My amendment does not represent any substantive changes to policy, but rather contains technical changes to the discussion draft circulated on Friday. These changes were recommended by the Food and Drug Administration and stakeholders. I ask the subcommittee to approve these changes to the discussion draft. Is there further discussion on the amendment?
Mr. Chairman?
Chair recognizes Mr. Pallone.
Mr. Chairman, I support this amendment, which would make technical changes to the committee print released on Friday. There are no substantive policy changes, but still there are significant improvements to the underlying bill. I do know there are still some small outstanding issues that need to be worked out before full committee, and I stand ready to work through those issues with you expeditiously. Thank you, and I yield back.
Chair thanks the gentleman. Anyone else wishing to speak on the amendment? If there's no further discussion, the vote occurs on the amendment. All those in favor shall signify by saying aye. Aye. All those opposed, no. The ayes have it, and the amendment is agreed to. Yeah, might as well.
Mr. Chairman,
I recognize Mr. Pallone for colloquy.
Thank you, Mr. Chairman. I'm pleased that we have been able to work in a bipartisan fashion to put together a strong user fee bill. It has been a culmination of many months, and I'm proud of what this committee was able to accomplish. However, one area that we did not include in today's bill was reform of FDA's cosmetic laws. Cosmetics and personal care products are used by Americans each and every day, and yet the regulation of this billion-dollar industry has gone largely unchanged since the 1930s. I, along with my colleague, Mr. Dingell, have introduced legislation that would strengthen FDA's role in regulating cosmetics in the U.S., but unfortunately, through no fault of anyone, we were not able to fully develop this legislation in time for its inclusion, Mr. Chairman.
Thank you, Mr. Pallone. I agree with my colleague. I am also interested in addressing the reform of FDA's cosmetics law, and I want to note the important impact that this cosmetic reform legislation would have on harmonizing regulations nationwide, encouraging innovation, and promoting the U.S. cosmetic industry, which employs 8.2 million Americans and generates a $5 billion annual trade surplus. Further, I know that Mr. Lance also has legislation to modernize the cosmetic laws.
Mr. Chairman, I appreciate the interest in these issues from my Republican colleagues on the committee. While we couldn't come to a bipartisan agreement before the deadline of getting the user fee legislation completed, I'm hopeful that we can enact bipartisan cosmetic reforms this Congress, which would modernize the law, strengthen consumer protections, and streamline out-of-date regulations. Following the subcommittee's work on user fee legislation, I intend to work hard to secure an agreement that can be broadly supported by regulated industry, consumer advocates, and the FDA alike.
I believe that this legislation is important for this subcommittee in Congress to act on this year, and I look forward to working with my colleagues to complete this important work as standalone legislation. Chair thanks the gentleman. Now recognize the gentleman from Louisiana for a colloquy.
Mr. Chairman, the committee mark includes a bill that I introduced related to valid prescriptions. While federal law clearly defines a valid prescription for the purposes of obtaining a controlled substance, no such definition exists for a non-controlled substance. The language included in the mark is intended to close a statutory loophole that has been exploited by unscrupulous and dangerous online drug sites. However, we discover that the bill as currently drafted may adversely impact legitimate telehealth services. We must ensure that this legislation restricts illegal online prescriptions, not undermine access to legitimate telehealth services. As we look to cut healthcare costs, we must not inadvertently constrict medical innovation. I have and intend to continue to work with members on both sides of the aisle to address this issue so that we reach a resolution before the full committee considers the user fee package.
I thank the gentleman from Louisiana and appreciate his work to address the issue of online pharmacies and ensuring the safety of prescription drugs purchased online. I believe we can collectively reach a resolution without adversely impacting innovation in the telehealth space before our full committee markup. Chair thanks the gentleman. Does Mr. Towns seek recognition for not mistaking? No. Okay. Any other? The gentleman, Mr. Towns, recognized.
Mr. Chairman, I have here a copy from NORD's press release in support of the FAST Act and a letter from BIO and, of course, the Everlife Foundation and 50 other patient groups, and I would just like to submit this for the record.
Without objection, so ordered. All right. Chair thanks the gentleman. The question now occurs on favorably reporting the discussion draft as amended to the full committee. All those in favor say aye. Aye. Those opposed, no. The ayes appear to have it. The ayes have it, and the discussion draft is favorably reported. Without objection, staff is authorized to make technical and conforming changes to the discussion draft approved by the subcommittee today. So ordered. Without objection, the subcommittee stands adjourned.